Um, Hi everyone, my name is Jocelyn Castillo, Community Health Specialist at the Yakima Health District. Today is January 13th and this is our COVID-19 update. Today I'm joined by our Emergency Response Coordinator, Nathan Johnson, and our Environmental Health Director, Sean McGee. Thank you both for joining us today. Um, Thank you. We'll start with a quick update on our numbers and trends. We've now had 23,369 cumulative cases of COVID-19 in Yakima County to date, with 114 new cases since yesterday. We've had 323 deaths associated with COVID-19 to date, and currently 47 individuals are hospitalized due to COVID-19, with 4 of them currently intubated. For trends, over the last week, we are seeing a steady amount of COVID-19 cases. However, we are still reporting a high number of cases. Each day, we are seeing more than 100 cases of COVID-19. This week, we are seeing lower hospitalization numbers than the previous week, which is good news. But similar to the cases, the number we are reporting on a daily basis still remains high. And unfortunately, each week we are seeing more deaths due to COVID-19. With that, I think it's important to note that while we have started 2021 with a lot of excitement and good news about the COVID-19 vaccine, it's important that we acknowledge that we are still in a pandemic, and that we have a lot of road ahead still. We have to keep our focus on bringing down the number of cases, hospitalizations, and deaths in our community. And so it is important that we continue to take precautions such as wearing masks, maintaining 6 feet distance between ourselves and others, and avoiding in-person gatherings. Today's focus is going to be on the new, on Washington State's new reopening plan and the COVID-19 vaccine. To start, the new reopening plan, let me share my screen here. The new reopening plan called Healthy Washington went into effect this week. And the new, rather than the Safe Start plan that was previously in place, this new plan bases reopening on regions instead of counties. If you can find more information about the plan on our website. Currently, all of the regions are starting in phase 1. The plan only has 2 phases right now, phase 1 and phase 2. And each week, the Department of Health will release information on how each region is doing in terms of meeting the metrics to move forward into phase 2. If you click here on the second paragraph, you'll find a weekly report from DOH with more information on the metrics that are being observed, as well as a table showing each region's progress and whether they are meeting those metrics. We'll be updating this report on our website each week as well. And with the new reopening plan, there are also new changes for business and activity guidance. And we'll turn it over to Sean now, who has more information about these changes.
Yes, hello everybody. Okay, so we're now in the roadmap to recovery, Healthy Washington. The entire state right now, all regions are in phase 1. So our South Central region is shared between Yakima County, Kittitas County, Benton and Franklin counties, Columbia, and Walla Walla counties. So what we're looking at here with phase 1 is we're still very similar guidance and business operations and activity operations as we were during the statewide rollback of phases. So we still don't have indoor dining. We still have in-store retail at 25% with active monitoring of the facility's capacity and things like that. So moving forward, where we're at now, we have to meet a certain set of metrics. And I want to discuss more what those metrics are to move forward. So what we're looking at is to move from phase 1 to phase 2 as a region. The average of all of our counties has to show a decreasing trend in the 14-day rate of new COVID cases per 100,000. And that trend needs to decrease greater than 10%. So we need to see a greater than 10% decrease in cases per 100,000 over a 14-day period. That's one metric. Decreasing trend in 14-day rate of new COVID-19 hospital admissions per 100,000. That trend needs to be decreasing as well, greater than 10%. Our average 7-day percent occupancy of ICU staff beds less than 90%, and 7-day percent positivity of COVID-19 tests less than 10%. So those are the 4 metrics we need to meet to move to phase 2. It's not, 25 cases per 100,000 like it was before. It doesn't matter. It matters less what our actual numbers per 100,000 are. Matters more that our trend, that we're trending downward in total cases per 100,000, hospitalizations, and then staffed ICU bed occupancy is below 90%, and our testing rate is less than 10%. So those are the metrics we're looking at to get to phase 2. So like I said, every region right now is currently in phase 1. That information will be updated weekly, as Jocelyn said. It will be included in the Yakima Health District's Friday and or Monday sit rep. The updated chart will be in. That chart will remain the same throughout the week for the sit reps. And I'm sure that information will be on our website as well. So the current guidance for specific activities and businesses is available on our website. It also is available on Governor Inslee's website at governor.wa.gov, and go to the COVID-19 page, reopening guidance for businesses and workers. And it'll give you all the current phase 1 guidance for all the different businesses, activities, gyms, outdoor, indoor recreation, just like similar to the guidances that were out there when we were in the Safe Start phase 1 and 2 for Yakima County. So all that information's out there. There will be future phases implemented, phase 3 and 4. I'm assuming those will be planned out and revealed once we start seeing our regions around the state move into phase 2 and show that we can stay in phase 2. So I expect further phases to be developed and revealed once that happens. So that's the update I have so far.
All right, thank you, Sean, for that information. Moving on to the COVID-19 vaccine, we know that many of you still have questions about how the vaccine is being distributed in our county. And so now it's Nathan's turn to give us a quick update on those distribution efforts.
Great, thank you. So I'll first start out kind of again reiterating what the process is for vaccine to even get into our county. At this point in time, on a weekly basis, the federal government distributes an allotment of the vaccine to the State Department of Health, and the state then allocates that to all of the different counties throughout the state and what organizations in each county. They are choosing organizations that have successfully completed the enrollment process. And part of that is looking at an organization's storage capacity for the vaccine, ability to vaccinate people outside of their organization, their freezers specifics, and just a whole list of what requirements that organization has to meet. Currently in our county, we have all 3 of our federally qualified health centers, so Community Health of Central Washington, Neighborhood Health Services, and Yakima Valley Farm Workers Clinic. We also have all 3 of our hospitals. So it's Astoria Sunnyside Hospital, Astoria Toppenish Hospital, and Yakima Valley Memorial. All of them, as well as some smaller independent pharmacies, have been approved and have started receiving the vaccine. They've been working through their staff. They've been working through some first responders that are following the state's 1A guidance. At this point in time, as a county, we are only vaccinating people who meet that 1A guidance. And again, that's high-risk healthcare workers, high-risk first responders, long-term care facility staff, and patients, and any other worker in a high-risk healthcare setting. With that, if you're a 1A provider looking for a place to get the vaccine, you can certainly go to our website under COVID-19 vaccine. There is a list of facilities available and a phone number and or email based on the facility on how to schedule an appointment. At this point in time, all appointments need to be scheduled ahead of time, and there is no walk-ins. So please look at our website, and we will push that information out in our social media pages as well in the future. So at this point, as a county, we've received 9,600 doses of the COVID vaccine. That's a mixture between the Moderna vaccine and the Pfizer vaccine. As a total in our county, we've administered 4,666 doses as of yesterday. All of our federally qualified medical centers, our hospital systems, and our other healthcare providers who are receiving this vaccine have really been amazing partners in this process, really trying to increase their capabilities and capacity to have this vaccine available to anyone who meets the criteria of the phase that we're currently in, which right now, again, is 1A only. Moving forward, we're certainly, we know that we can't put all of the ask on our healthcare facility to have this vaccine available. And we know that we can't just have a couple community vaccine clinics, kind of like how we have our testing sites. And we can't put it all on them either. So it really has to be a mixture of tools in the toolbox. So we're going to continue working in very close partnership with our FQHCs and our hospital systems and other healthcare providers, but also looking at how we can start molding our testing sites and what that would look like to also have the capacity to do vaccine distribution as well. We're also looking at some other different options on what a community vaccine site would look like. Again, really trying to accomplish the goal of having accessible and low barrier vaccine distribution in our county, just like we've accomplished with COVID-19 testing. That's kind of a picture of where we are right now and what we're looking at moving forward. As we move forward into different phases, we will be pushing out information on that. And again, continue working in very close partnership with all of our partners throughout this process. It's really going to take a whole community to come together to move this mountain, and that's kind of where we're at.
All right, thank you, Nathan, for that update. As Nathan mentioned, we'll be continuing to provide more information about the vaccine. And I just want to remind everyone that, let me share my screen real here, that all of that information is also available on our COVID-19 vaccine webpage here. We'll also be sharing more updates through press releases and these weekly updates as well. So please watch out for those updates on our social media and on our website here. So that's it for our update today. Thank you for watching, and remember that we are doing these updates every week. So please watch out for these as well. Thank you.